Hello, RAP students. I'm Dr. Smith. I'm here today to talk to you about the circulatory system. The circulatory system is very important in our body. It works with other systems, but the biggest thing that the circulatory system does is it pumps blood and nutrients through the body. Now, some other names that you may hear that have to do with the circulatory system is cardiovascular system. So cardio means heart and vascular means vessels. So that can give you a clue as to what we're going to be talking about when we talk about the circulatory system. But before we get started, we're going to kind of give you real life examples of the how to measure the cardiovascular system or the circulatory system. When you go to the doctor, your doctor can measure the rate at which your cardiovascular is working by taking a pulse. You can put your 2 fingers over your wrist near your thumb, like I am, and you should be able to feel a pulse, kind of like a beat of a drum. And that's telling you kind of the rate or how fast or how slow your cardiovascular or circulatory system's working. Sometimes people take it here, especially when you're working out, but be careful not to push too hard. Also, when you go to the doctor's office, that same pulse oximeter I was talking about before shows up because this system works with your respiratory system, and they measure how well they're working together using this. So when you see this, think respiratory system and circulatory system, okay? They're wanting to know how well you're breathing and how well that circulatory system is working, the one that pumps the blood, okay? Now, the other thing they can do is use that stethoscope. The doctor will put these in their ear and they will put it over your heart. Your heart is close to the middle of you, but a little bit to the left, okay? The left when you're looking at somebody like this. So they'll put it here and you'll hear that same beat that you felt when you put your fingers on your wrist, okay? So now let's get into what the circulatory system actually includes. So the first thing is the structures. You need to know what is it made of. Hint was cardiovascular, heart and blood vessels. Now, there are different sizes of blood vessels that run throughout your body. The other name for the small vessels capillaries. They're teeny tiny vessels. You also have veins and arteries. So whenever you hear these names, capillary, I don't know how many people actually hear capillary all the time, but vein and vessel has to do with your circulatory system, your blood. All right, so now we're going to talk about the heart, and that's going to tell us how all of this works, because we're going to include the lungs too, okay? The heart. The heart, you would think the heart would be shaped like this, but that's just the way we do it for like Valentine's and things like that. The heart is actually, I'll see if I can draw it. Like I said, I'm not the best drawer. I used to be really good at this. This is one of my favorite organs. Okay, so the heart has 4 parts. I'm just going to divide down the middle for now, just so you get an idea. Okay. On this side, which is the right side, because you're looking at the person like this. This is their right side. The right side is where you have deoxygenated blood. That means it doesn't have a lot of oxygen. We're going to use that with the blue. On the left side, if I can get it open, I'll write it down. On the left side, you have oxygenated blood. That means that it has a lot of oxygen. So what happens here is that the blood that doesn't have much oxygen goes into this part, which is a atrium. And it flows down into the ventricle. I know these seem like complicated words, but just make sure you get the concept if you are having problems grasping the words. Okay? Now, right along in between these two, it's what's known as a valve. So let's put over here valve. And I'm going to point it right here. This valve keeps the blood from going back into this part of the heart. Once it comes down and it's full, the valve shuts and the blood cannot go back into the atrium, which is really good. You don't want that to happen. Then it leaves and goes to the lungs. There's the lungs. That's where the lungs come in. And the reason it goes to the lungs, think about it. It doesn't have much oxygen. Goes to the lungs to get some oxygen. Then, once it has oxygen, it comes into the left atrium. And it goes down into this ventricle. See, you heard that word before. And again, in between these two parts is another valve. Because you don't want, once this part is full, you don't want any of the blood to go backwards. That's not the direction we want to go. And then it goes to the body because the body needs oxygen. Now, if you watched the respiratory system, you know that the body's blood goes all the way throughout because we need oxygen throughout our whole body. Now, with the respiratory system, the lungs, of course, is going to get that blood that doesn't have oxygen, and what's going to happen at the alveolar? If you remember from the last one, that's where there's an exchange of the oxygen for the carbon dioxide. And so now that blood leaves the body. That oxygen, that deoxygenated blood gets oxygenated, and the waste carbon dioxide is going to make its way out of the body. So that's how those two are connected. Saying that, when we go back to what's called the pulse oximeter, which is what you measure here, the pulse, This is measuring the rate that your heart is beating, but one of the numbers is telling the healthcare provider how much oxygen is in your blood. And we need oxygen to live. So that's why they want to know that. And usually, if you're really healthy and you're doing just fine, it will be at least 98%. You'll see a 98, 99 on something like this, okay?